Hi guys, I'm Dr. Rajat and we have just started with our clinical endodontic training on live patients. So this is our second day and we have Dr. Tanya with us. We have just covered the basic idea of Rotary Endodontics. I've just explained her about different pro tapers system that we have. So talking about the path files and pro tapers, what do you think the path files are? What exactly are the role of path files? What are different path files that you have?
Path files are the rotatory files and which are of the sizes 13, 16 and 19.
Yes.
And
what is the taper? What is the taper for those files?
2% is
Yes,
tapered
yes.
for the
And
files.
what are those cutting tips? Is it cutting or non-cutting?
They're the non-cutting tips.
Yes, perfect. You're doing well. Non-cutting tips, and these are night-eye files. Okay. Now talking about the hand files, that is profinders. What do you know about profiles?
There are
Tell us
the profinders are the hand files,
Yes.
which are of the sizes 10, 13 and 17.
Perfect.
They have 65% non-cutting
Yes,
and 2% taper.
Yes, they are made up of stainless steel, not night-eye. So they all add on to your glide path. They help you in achieving a good excess opening, excess canals. Now talking about different files, like you have a sequence of SX, S1, S2, F1. Now talking about SX, what do you think? What is the taper for an SX file?
3.5.
Perfect. And what is the tip size?
0.19.
Perfect. What is the taper for S1?
What is the taper?
Yes.
Taper 2 to 11.
Yeah, it has a variable taper that helps in negotiating the canal pretty well. And what about S2?
S2 has a taper of 4 and the tip size is 0.20.
Perfect, perfect. And now talking about the finishing files, what about F1 and F2?
F1 and F2, they are of this size, tip sizes 0.20 and 0.25 for
Perfect.
F1 and F2.
Perfect.
And the taper for them is 7 and 8%.
Perfect, perfect. That's pretty good, for a second day, and I'm very happy that we have started, training with different systems and talking about the basic idea of tapers. Having knowledge about tapers is very important in endodontic practice. You have to negotiate. You have to refine the canals in order to achieve a good excess. Now I'm very happy. I'm looking forward for a great session ahead, and I wish her all the best. तुम्हें कैसा लगा? अभी all these we have just covered few basic topics with excess opening. How do you think it is gonna change your endodontic practice? कुछ फर्क लगा? कुछ मजा आया?
Experience from coming from college again to another step ahead. It was a nice experience.
पहले टेपर के बारे में थोड़ा सा आइडिया था.
And
Now you have to manage. You have to keep yourself updated, keep yourself knowledgeable in such a way that you are gonna. Now we're gonna be starting with the patients next week. So I'm wishing her all the best. I've given her quite a bit of matter to read. So once she reads up, we will have a mock-up test before she starts with the patients. And I wish you all the best. Cheers.